Hello, my name is Scott Burns. I'm a physical therapist, and I'm also the associate professor at Temple University, and I'm the director of the Doctor of Physical Therapy program, as well as interim chair for the Department of Health and Rehabilitation Sciences. In my clinical practice, I have background primarily within musculoskeletal orthopedic type conditions, as well as a strong interest in individuals living with chronic disease and chronic pain in particular. So today I'm going to talk about how do we deal with these chronic pain conditions, particularly during the year that we've had a pandemic, elections, and civil unrest. So the definition, just quickly, from the International Association of the Study of Pain. It's an unpleasant sensory and emotional experience. I usually highlight that because it is an emotional experience that people get with pain. And it's associated with actual and or potential tissue damage. So you don't necessarily have to have tissue damage in order to create a pain experience. So what I'm talking about, there's a lot of common conditions that this might be related to, including things like osteoarthritis, low back pain, neck pain, some other things that are a little different, like fibromyalgia, carpal tunnel syndrome, chronic fatigue, even things related to GI, like irritable bowel syndrome. And these types of conditions, and this is not an exhaustive list, but these types of conditions are exacerbated by a lot of things. And we know this through some of the research in chronic conditions, that poor sleep, stress, any type, emotional, financial, relationship stress, just in general, can be a trigger. Social disconnectedness or disconnection, anger, worry, frustration, poor nutritional habits, lack of physical activity, and blurring of typical life norms, which I'll get into that in a little bit. So you can kind of imagine a lot of the things that have been going on in 2020 and how they may have been changing some of those things that are known to aggravate or inflame chronic pain conditions. So we've been in this 2020 where everything has just been fine, right? This is what we keep telling ourselves, but in reality, we have had a lot going on. We've had civil unrest in the United States. We've had COVID-19 worldwide. And also in the United States, we've had a lot of recent political stress that I'll say goes into this thing. So you pour that all into the same glass, the same year, and the same person, and boom, that's a recipe for having an exacerbation of chronic pain. So we've had a lot, and we do keep just trudging through it, and we just need to recognize that this is a lot, and particularly if you think about stress, it's probably impacted sleep, nutrition, physical activity, which we're going to talk about here in a minute. So pain is a construct where it is not just I cut myself on my finger and I have tissue damage and I have pain. There is that type of pain, but a lot of these chronic or persistent types of pain have a lot more layers, if you will, underneath them. So yes, it started probably as an initial pain experience, but now it's being shaped and driven by things such as attitudes and beliefs, psychosocial issues, illness, behavior, as well as the social environment. And 2020 has really challenged a lot of these other things that are known to influence chronic pain conditions. So where do we begin? A couple of things I'm going to talk to you about are some general recommendations, but there's a few things that we can begin to try to keep ourselves on track and keep our pain to a manageable level. And that's really the end goal, is to keep it to a manageable level. Getting it to go away is not usually a feasible goal. Usually getting it to a manageable level and keeping it there where you can kind of manage it and keep it where it needs to be is really where we want to be. So some general recommendations is really be patient with yourself, be patient with the pain. That's really hard. But I think this year, one of the things that 2020 has brought us is we have to be patient because there's a lot of things that we can't control right now. So be real patient. Try not to fall for pain gimmicks. There's a lot of things that purport themselves to be a cure for pain or chronic conditions. There isn't a cure, otherwise everybody would do it. It's a very multifaceted approach you need for getting through this. And I've had a lot of individuals that I've worked with that have conditions, and they end up spending a lot of money, time, and ends up creating a lot of frustration when these purported cures for pain don't work out. Know when to seek assistance, and particularly seek assistance from individuals that are skilled at pain management, not only from a medical standpoint, but from a rehabilitation standpoint. Also, try to tend to focus your control or your efforts on things that are actually modifiable. So it's really important that you think about things that are modifiable, that you can control, not things that are unable to control. I'll kind of walk through what some of those are. And then also set realistic expectations and goals. And I kind of went over that, where the goal is really to manage and keep it in a level that is relatively comfortable, but something that you can still function and live your life with. But the goal of getting rid of pain, if you've had it for a number of years, is something that's not really always attainable. So setting goals in 2020, or setting expectations, right? 2020 is kind of, this is what we thought working from home would look like on the left-hand side, but in reality, it may look something a little bit like the thing on the right-hand side. I know I've definitely experienced that, where I've been having to do multiple tasks all at the same time, whether it's with kids, life, that kind of stuff, while I'm also doing work. So it's definitely created some challenges in terms of expectations. So for your, it's also changed with your pain. It's the same kind of thing. You've had expectations that it should get better, but in reality, it's been a little bit different of a path. Next, these things are some of the areas that we talked about just a minute ago, but what things here are actually modifiable? There are a number of these things that may be modifiable, and I would probably argue that the majority of these items on this list are things that you can modify, at least to some degree. You can see in some of those pictures, poor sleep. We'll talk about that one in a minute. You could also see people getting frustrated, depressed, worried. All it takes is a start, really starting to think about, how can I modify some of these things? So let's first talk about something that's near and dear to physical therapy. And there are a couple of other presentations on the Temple Talks, one on mindfulness and another one on physical activity, that you could also think about in terms of pain. So during COVID-19, if you look on the left-hand side there, physical activity is estimated to decrease by about 33%, and our sitting time has gone up about 28%. So this right there is a lack of physical activity and an increase in sedentary and stationary positioning. That's a pretty well-known recipe for having someone start to increase their pain and have a flare-up, or whatever you'd like to call it. So it's really important that, and this information came from the British Journal of Sports Medicine, so a very reputable source. It's really important that we start to think about, how can we break these up? And obviously there is that whole other talk done by Dr. Kovacs that talks about how much physical activity, and it doesn't mean that you need to run. It's just, there's a lot of ways to do that. And that there's informal activity, which you can see at the top there: cleaning, laundry, outdoor work in the yard. There is aerobic activity, and there's a more formal exercise program. Really, the goal is you want to make sure you get up around 30 minutes for 5 days a week, and that gets you to that 150 mark. So physical activity is known to decrease your pain and increases your body's tolerance to it. So that's a really important thing. Next, additional recommendations: physical activity. If you don't do physical activity, your sleep is actually worse. So it's important to make yourself tired a little bit with the physical activity, and that will then help your sleep. Limit your screen time, avoid eating and drinking, and do something enjoyable each day. So blurring of typical norms, what I talk about here is, right now our current work setups may be at home in our bedroom. I know that's where mine is. My office is also where I sleep, which is a typical place of sleep, not of work. So it's an important thing to start to take those and start to establish normal boundaries again. So if you're using electronic devices, eating, or like that picture up there where they have their actual desk over their bed, those are usually not thought to be real helpful in terms of chronic pain, because then it doesn't actually have an idea about, no, this is where I need to sleep. The pain doesn't understand that this is where I need to sleep and rest and let everything turn off when you start to do all these other things in that same space. So couple other things, healthy life routines. This is again going back to those typical norms. Try to get up and go to bed around the same time frame. Get ready each day as if you're going somewhere. I know right now it's easy. There's no real big accountability as to what we're doing. So a lot of times it's hard to even get out of, pajamas and things like that, but really try to establish those normal routines that you had. Also schedule out self-care and hobbies. It's really important that you find things that are of enjoyment that take your mind away from pain and other things related to your pain. Establish those normal boundaries. So again, the bed is the primary area and the bedroom is the primary area where you don't want to start to blur the lines, if you will. And then also for social disconnectedness, it's important to try to talk to other people, and obviously within the guidelines that we can do in 2020 and keeping ourselves safe, whether that's through electronic means or socially distanced avenues. But it's really important that we do have some version of social connectedness, because it is very easy for individuals with pain to isolate themselves. And 2020 has definitely pronounced that with COVID. So as I end, the last slide I have here is, change in some of the habits we have. We've experienced a ton of change, but at this point, it is very difficult for us to deal with change. But I also think this is a great chance for individuals that are living with chronic pain conditions or persistent pain, that they can make a very positive change that will give them a much better chance at improving their quality of life over time. So with that, I will conclude. Thank you again. I wish you the best of luck.